All right, good morning, Chair and board members and staff. The lobby is open and recording has begun.
Good morning. Thanks, Dustin. We will convene the Liquor and Cannabis Board Caucus meeting for Tuesday, January 4th, 2022. I was sure I was going to get that wrong, but I got 2022. Happy New Year, everybody. Welcome back. We will jump right in with approval of the minutes from our December 14th caucus. Motion for approval.
I move approval of the December 14th meeting minutes.
And I will second.
Great, and approved. Thank you. Our first official business of 2022. We are going to move on the agenda to agency updates, but has Rick joined yet? Are you on, Rick? No. Okay, we're going to come back to that, and we're going to move to board meeting prep and rules update. Kathy Hoffman, I'll turn it over to you.
Great, thanks, Chair Postman. Good morning, Board Member Garrett and Howgie. For this year so far, with start with alcohol. On our axe throwing rule project, conceptual draft rules have been completed. I think there's a few finishing touches that need to happen to those. But we do have a listen and learn session scheduled for January 27th, so the end of the month. Have 3 hours set aside to do that. So looking forward to that. Messaging should go out next week. General gov delivery like we typically do it there. With respect to the CR 101, we received 3 comments. That comment period closed on November 19th, but we continue to accept comments. And they just trickled in very slowly, and there haven't been any more than those 3. But really, we're just largely in support of allowing axe throwing in Washington and then giving reasons why, so on and so forth. So questions on that before moving to the next? Okay. So with respect to general rulemaking, Robert and Jeff are working on the electronic service rules. There have been a couple of internal meetings to scope that project, make sure we're touching on all the right rules, and then kind of forming the CR 101 for that project. It is going to be very narrowly scoped, but the impact of adding this electronic function may, cross more than one rule set. So we want to make sure that we're getting, or I should say rule section. So we want to make sure that we're hitting everything that we need to in that work. But CR 101 should come to you guys on February 2nd. So relatively shortly. And then based on that timeline, we're planning on bringing a 102 by March 15th. Because it is a really technical rule project, and we really don't see that there's going to be a whole lot of controversy around it. And it's value added. So a lot of efficiencies, I think, can come from that rule project. So questions on that one? That was pretty straightforward. Go ahead.
One quick one. Are there any like external government partners? Do we need to deal with Office of Administrative Hearings or anybody like that to make sure?
I'm not sure yet, and I know, Jeff, can you pop on for a minute? Is that something you guys have talked about in the project team for this yet? Have you gotten to that point yet?
No, we haven't really thought about the interplay with OAH, if that would affect their processes or not. That's something that we're certainly aware of.
And yeah, and I don't know if it does, but I know, since they're our partner there, I'm Tanea Smith and others, Ed Marie probably can help us too on that front, but great. Thank you.
Thank you.
All right, ready to move on to cannabis? Okay.
Definitely.
As you know, quality control rule CR 102 successfully filed after the last board meeting. Hearing still set for February 2nd so far, and Jeff, correct me on this, I believe we've only received 1 comment.
We've received, I think, 7 so far.
Oh.
Yeah, a number of them have come directly to me instead of to the rules inbox, but I believe we're at seven comments that really that are directed at the rulemaking.
Okay, and do you have a sense of those comments?
They're Yeah, a couple of comments were about testing for other substances like radioactive isotopes in Eastern Washington. There was a comment about testing for benzene, which we already do. That's part of the current rule, and it will continue in the proposed rule. There was a comment concerning possible delays to getting product tested in the labs because there are fewer labs that perform pesticide testing rather than just the panel of I-502 testing. That comment came from a producer. That's kind of the gist of the comments we're getting.
Okay, thanks for that, Jeff. All right. Anyway, we're still on track to bring final rules to you on March 2nd.
Great, good. Again, as we said, I to respond to what Mr. Kildall just said, I hope the labs are watching. They all know it's coming, right? So it's probably a good business to get into because it's going to be a requirement. And I understand that today there's not that capacity that the producers would like, but I sure hope that by the time this becomes final, that it's a better market out there.
Sure. And Jeff, remind all of us, I guess. I think there are 5 labs that can do the I-502 suite plus pesticides at this point, right?
Yes, it's currently 5.
Okay, so about 50%, a little less than 50% of our labs. Okay.
I believe there are 11 labs and 5 can do the pesticide testing currently.
Okay, thank you. Great. All right, so if no other questions on that, I'll move on to THC compounds. Okay. So I will bring the CR 103 to you tomorrow for adoption. Sent the package out. I think it was in the middle of December. I had that package ready to go pretty early. And you might have noted there were only 2 comments received. One asking us to change the word may to must in the board's ability to determine whether or not they were going to prohibit the entry of a product into the market. So we didn't make any rule changes based on that suggestion. Board needs the flexibility to be able to make those kinds of decisions and decide on what agencies they will work with in making those decisions, right? That's similar to what we did with implementing House Bill 2870 and the THC vapor product rules. Anyway, a second comment was from a hemp producer who indicated that they were selling THC, or was it D8? They were selling D8, THCO perhaps from their hemp retail establishment, and were opposed to any sort of restriction on THC compounds, regardless of origin.
And that's selling into the 502 system store retail?
No, they're selling it from a hemp store.
Okay, interesting.
And that letter is embedded in the concise explanatory statement. If you want to take a look at it, it will be, when Dustin releases the package with the, it'll be there as well for the public to see. But yes, so just some opposition from hemp retailer and any sort of restriction on THC compounds at all. So rules didn't change as a result of that comment, but just wanted to bring it to your attention and make you aware that the letter is embedded in the concise explanatory statement. So if adopted tomorrow, rules would go into effect on February 5th. So questions on that?
Not for me.
Okay.
No.
And then finally, with respect, go ahead, Russ.
Kathy, Jeff, are you at all struck by the lack of comments that we've gotten on this rule package?
That's a really good question. In some ways, yes. I also think that perhaps there's a lot of focus on our request legislation. But I also think it sort of speaks to the amount of work that we put into working on this issue and while we were developing these rules. So that some of the questions I think that people might have had around what our intentions were, with this rule development project and with our request legislation and everything else that's gone into it, it's been pretty clear what these rules were designed to do. And it also made it abundantly clear what the agency's implications were with respect to restricting the entry of these products into our system.
Yeah, it's concerning to me, and I'm leaving soon, but it's concerning to me that we're having in this rule package a great step forward to deal with a kind of an existential threat to what we'd set up. And we're not getting a whole lot of comments. And we also have lobbyists saying explicitly that they are going to forego engaging in the rulemaking process because they think they can get what they want better in the legislature, which is, basically cutting us out of the process. I guess I'm just very concerned about that. The rulemaking package is first rate, and I can't imagine a more thorough preparatory process to get to where we are now, which is the right place to be. But I have concerns going forward that this good hard work may be undercut by actions of the legislature.
If I share the concerns, we've been talking with legislators, the chairs of both the House and the Senate committee, good meetings with the ranking Republican in the Senate side as well. I have no idea where we are in the end, but I think that so far, we're getting good support from really leaders in the legislature in the cannabis area. They understand the existential threat that this is, as you put it. But yeah, I think that it's going to be really incumbent on the agency staff as well to watch as just as carefully as they can during the session, because that it'll happen late in the session and it'll be sold as a small change or this or that. And we really, so much work has gone into figuring out, how do you define this versus that, and what is the path for, non-impairing products, and it should be dealt with in a dispassionate way, as we have, and with the technical expertise. So I would just say, yeah, I think your concern is a good one, and I think we're going into this session with our eyes wide open about what is at stake, and really trying to make sure that legislators have all their questions answered, and Chris Thompson's been doing a great job communicating this, both that we've had a series of meetings, as well as one at least written update he sent to I think, well, at least all committee members, maybe even further than that. So yeah, I don't have any magic answer to that, other than, yeah, I think that concern is there, and it's incumbent on us to be on our toes for that.
Also, I hope that the industry is paying attention and know that their voice is going to be important during session, to show up, speak up. That's going to be very important that the industry speak up on this.
Absolutely.
As an agency, we can't do it alone.
That's right. And I think that what we've come up with here is responsive to what we heard from large segments of the industry. I think what we're finding, and Ms. Hoffman could probably add a little more to this, but there is a split in the industry, and we're in somewhat of a middle ground. There are people concerned about these compounds who wish we would go a lot further in prohibiting outright. There's a small segment that want it more wide open to be able to create product in laboratories. So I don't know that we're going to hear from, a bunch of people, licensees who embrace this legislation fully, which be interesting. I think what we've done is we've taken an independent path here that I think creates the system going forward that does what we've heard from a majority of the industry that they want. But we haven't seen that sort of support yet for the legislation. So there's still time.
Yeah, and like I said, I think that's going to be important, and that they fully understand whether what we put together is getting the industry everything they want, that this is better than what else is out there trying to come against this.
Well, that's a great point too, because we're not in a vacuum. There will be another bill that does not go in the same direction we are, that would allow the hemp-derived THC that we haven't seen yet, but I've been told that to expect a bill from that side. Sorry, Kathy, were you trying to say something there?
Well, thanks, Chair Postman. I was going to say, really, I think that Washington State's taken and I don't want to say neutral, but a middle, sort of a middle ground, where's the a balanced approach to this, whereas there are a number of other states that have outright banned Delta-8. So they've taken a pretty extreme position. And so I think where we've landed with this is kind of in this middle position. At the same time, I wanted to really highlight the public health and safety concerns here. And I just sent an email today to someone with all of the upticks that we're seeing in adverse event reporting for Delta-8 overconsumption or accidental exposure on the pediatric side. And that's as recent as November. I'm still waiting for updated information. But this to me is, and I think to many others, we learned a lot from the E-Valley outbreak. And our agency is responding in a responsible way to Delta-8 in the same way. And I think that this rule set gets us there, and hopefully the legislation will help us as well.
Yeah, and some of us saw this email from the Hawaii agency yesterday. They're doing research on adverse impacts and have asked all states for what they're seeing there, because they're facing some of these same issues at that side. So, yeah. Okay.
All right. Anything else on that? All right. So last rule project on the cannabis side is social equity in cannabis. And I actually am starting to draft some rules. There's a working on the social equity program itself, rules. We'll know more about that as licensing and I continue to work towards draft conceptual product there. But I can tell you that I've taken the licensing rules, reorganized them pretty significantly, I will say. Reminds me a little bit about the work we did with implementing House Bill 5318. Reorganized it and a little flows a little better now, I think. And we also removed some of the language that seemed to create barriers. Some of it was legalese, some of it was just words that I think we typically use in rule drafting, or used to at least. And so we've done some significant work there. We're also thinking about stakeholder engagement options. I do want to have listen and learn session so that we can stay on track with this by the end of February. Very aggressive timeline, no, but we want to be able to be as responsive as we can, as quickly as we can, and as inclusively as we can. So look for information on that in the coming weeks. So but all that to say, we're making great progress, and I do anticipate that we'll be able to adhere to that aggressive timeline for this first effort, at least. So those are updates for today. Any other questions, concerns?
Not for me. No.
Thanks very much.
Thanks. We'll see you tomorrow.
Yes.
Okay. We will move back up one here to agency updates, and I'll turn it over to our director, Rick Garza.
Good morning, board members, Chair Postman.
Morning.
Garrett and Hauge. I'm sorry I'm late jumping on this call. Apologize. I want to, actually, I didn't have a lot to share, but something that Russ Hauge had shared about the discussion that we were just having. We have wrapped up our contact with legislators, as David said. We did that a couple of months ago, given the concerns that we were hearing about legislation that was out there, not only to reorganize the board, but contrary to the work that we're doing on our cannabinoid legislation. So I just want to assure you, as David has, that we've been in numerous discussions with legislators the last couple of months, especially in the last month, to make sure they understand our bills and understand some of the concerns we have about some of the bills that may be coming our way, and pretty much covers the gambit in the way that both Ollie and Russ have described it, and David and Kathy and others. So I just want to be sure that you're aware that that's happening, and in discussions with other industry members on the cannabis side. So just wanted to add to the discussion that you had, that David had shared about needing to make sure that we're in really close contact, and we're looking forward to the discussion on our bills, which even the first one may be heard next week, or certainly the second week. So I think we're making great progress in discussions with legislators to understand where we are, especially on that cannabinoid bill. Any questions with respect to that? The only thing I would also add internally is that, as you may be aware, and we talked about maybe the last time, is that the governor's office had asked on the road to recovery, and then that agencies begin to open up their buildings, and we were looking at doing that on January 3rd, and then during the Christmas holidays, the governor's office made it clear, given the variant, that we would stall and wait to do anything until February, and I suspect, given what's going on with the new variant, that it would not be until probably through winter before we would consider reopening the building to the public, and just wanted you to be aware of that. And there should have been emails that you received from Tony, our deputy, that shared that. So frankly, I don't have much more, board members, so take any questions that you might have.
The only one I have, and I know I asked you this yesterday, but we haven't seen a hearing scheduled yet, or we don't know for sure on the THC bill, right? Other than just we expect it early in the session, at least.
Yeah, I think that's right, David.
Okay.
I know the schedule comes out, it has to be confirmed today to be out on Thursday for next week. So I don't know that we'll make it for next week, but it's possible that they will be. But as you know, in the meetings that we've been in with legislators, we're getting really good support for it. So that's great.
When that does get scheduled, if you could just have someone let all three of us know. When
yeah, I'll have Chris do that.
Okay, good.
We'll have Chris do that, you bet.
All right. Any other questions or comments from everybody? No. Okay. Thanks, Rick.
Thank you.
And that takes us to board and executive assistant reports. Dustin, I'll check with you first. Anything to report in the new year?
Nothing additional for the good of the order. I think we're set and ready to go. Board meeting tomorrow, busy week again next week, caucus and EMT. So it's a busy month with lots of public meetings, but nothing additional outside of that.
Okay, great. Thanks. Anything from members to close this out? Please, yeah, Member Hauge.
First, may I be excused from lit review this afternoon? I've got a doctor's appointment I've got to get to, and it would be difficult if I had to do that.
Yeah,
thank you. I appreciate that.
We reserve the right to hold any difficult cases for when you come back, like we did last time. But yeah, no problem at all.
I'd be happy to help however I can. I really appreciate the consideration. And next, under the heading of informed healthcare gossip, as you know, my wife works at a big hospital in Tacoma, and their caseload COVID hospitalizations has doubled in the last few weeks. And there is no sign of it slacking off right now. And the secondary effect is that so many healthcare workers now are testing positive that has put the hospitals at a real disadvantage. And of course, the most seriously affected are the unvaccinated, but still there's enough of them with this new variant that it is overwhelming. And my wife would not, I think, appreciate this, but she's really concerned. This is a big deal right now.
Yeah, thanks for sharing that. I was just saying this morning, unlike any other point in this pandemic, I hear from somebody every day who's got it. It used to be you would know somebody who knew somebody, and it is, they say, not as deadly as the Delta variant, but it clearly is dangerous and is making people sick. And I know Thurston County is having some of those same hospital capacity. Yeah.
My sister and her family got together Christmas Eve, and it turned out to be a spreader event. And the kids got sick. They recovered, but she, being of an age similar to mine, has not, even though she is vaccinated. So it's a big deal.
It is. And vaccine and boosters is the first thing, and then being mindful of those gatherings, which over the holidays I know was hard for everybody to resist. I did some too, but small. Yeah, with no end in sight, I'm afraid. Yeah. But okay. Well, with that, all right. Member Garrett, anything else we need to discuss? No. Okay. We will see you both tomorrow for the board meeting then. Great. And with that, we will adjourn the board caucus meeting for January 4th, 2022. Have a great day, everybody.